Welcome to the Deep Dive. We're here to take your sources, really unpack them, and get right to the core of what you need to know. Today, we are plunging into a topic I know many of you, especially horse owners, are familiar with, but maybe not its full complexity: equine Lyme disease. You sent over some fantastic material, really great stuff, and we're ready to get to the bottom of it for you.
Yeah, it's definitely a condition that gets talked about a lot, sometimes misunderstood, though. And, well, it's notoriously challenging. Diagnosis, treatment, the whole thing. So our mission today is basically to pull out the most important knowledge from the sources you sent, cut through any, information overload, and leave you with a really solid, informed understanding.
Okay, perfect. So let's kick things off right at the beginning then. What exactly is equine Lyme disease? What are we really talking about here at its heart?
At its core, it's an infection caused by a specific bacterium, Borrelia burgdorferi. It's a type of spirochete, kind of spiral-shaped and motile. Here in North America, the main player is Borrelia burgdorferi sensu stricto. That's the one we're primarily dealing with.
Got it. Borrelia burgdorferi. And it's tick-borne, right? That's the key transmission route.
Absolutely. It's transmitted mainly by Ixodes species ticks. You probably know them as black-leg ticks or deer ticks, depending on where you are. It's Ixodes scapularis in the eastern and central U.S., or Ixodes pacificus out west. And interestingly, these ticks pick up the bacteria from what we call reservoir hosts, usually small mammals like white-footed mice. They're a big part of the cycle.
The white-footed mouse, huh? An unexpected player. So the tick connection is obviously vital. How does the horse actually get infected? Is it like immediate? The second the tick bites?
No, not instant at all. And this is really, really critical detail for prevention. An infected tick typically has to be attached and feeding for quite a while. We're talking at least 24 to 48 hours, often cited as, more than 24 hours. That's how long it takes to transmit enough of the Borrelia spirochetes to actually cause infection in the horse.
Wow, 24 to 48 hours. That really makes daily tick checks sound incredibly important then, doesn't it?
Absolutely paramount. It's probably the single best defense.
And I've heard horses called incidental hosts or dead-end hosts for Lyme. What exactly does that mean for the horse and maybe for managing it in a barn setting?
Yeah, exactly. Horses, much like us humans, actually, they can get infected, sure, but they don't really play a big part in keeping the whole tick bacteria life cycle going in nature. So they get infected, but they don't really pass it on effectively or maintain it in the environment. And crucially, this means the infection is not contagious from one horse to another. So you don't need the same kind of biosecurity you might for, say, strangles or flu, thinking about horse-to-horse spread.
That's a relief, I imagine, for barn managers.
Definitely. And as you'd expect, this disease is most common in areas where these Ixodes ticks live, the hot spots, the Northeast, Mid-Atlantic, Upper Midwest in the U.S. But, and this is important, those tick ranges are expanding. So areas that maybe didn't see much Lyme before are starting to see it more. The risk is growing.
Okay, so the tick bites, it stays on long enough, the bacteria gets in. What happens then? Inside the horse, does every horse that gets infected actually get sick?
That's one of the biggest challenges with Lyme, honestly. A lot of horses, maybe even most horses, exposed to Borrelia burgdorferi become seropositive. They develop antibodies, you can see it on a blood test, but only a fraction, a subset, of those actually develop clinical signs. Actually seem sick.
So the body fights it off silently sometimes.
Often, yes. Or it remains subclinical. When it does cause problems, the bacteria tend to spread out, disseminate. They seem to like connective tissues, the lining of joints, synovial membranes, and nerves. The exact way they cause disease is still being figured out. It seems to be a mix of direct damage from the bacteria themselves and also the horse's own immune response trying to fight them off.
Right, the immune response itself causing issues. So thinking about those horses that do get sick, what are the clinical signs that are really well documented, the ones we can confidently link to Borrelia?
Okay, so there are three main syndromes that are pretty consistently documented. First, there's neuroborreliosis. This is infection hitting the nervous system, central or peripheral. It's probably one of the most consistently recognized forms, but the signs are super variable. They can look like a lot of other neurological problems, which makes diagnosis tricky.
Like what kind of signs?
You might see things like behavioral changes, depression, lethargy, maybe irritability or even unusual aggression, increased sensitivity to touch, that's hyperesthesia, ataxia, so incoordination, weakness, paresis, difficulty swallowing, dysphagia, muscle wasting, neck stiffness. Rarely you might even see encephalitis, seizures, or a head tilt. It's a wide range.
Wow, okay, that sounds quite serious. What's the second one?
Second is uveitis. Inflammation inside the eye, specifically the uveal tract. This is generally thought to be an immune-mediated thing triggered by the infection. Signs would be squinting, tearing, maybe you see sort of yellow-green haze or flare in the eye, a constricted pupil. It can come on suddenly, it can be recurrent, come and go. And if it's not treated really aggressively, it can cause severe damage pretty quickly, even blindness.
Eye inflammation, okay. And the third?
The third is called cutaneous pseudolymphoma, or sometimes just Lyme dermatitis. This is basically skin inflammation right at the site where the tick bit. It shows up as these firm nodules or maybe plaques in the skin. They usually don't itch. They can actually look a bit like a benign skin tumor, a pseudolymphoma.
Okay, so those three are quite distinct. Neuro, eye, and skin. But what about all those other things people often worry about with Lyme? You know, the vague lameness, maybe shifting leg lameness, just general stiffness, or a horse that's just grumpy or not right. Where does that fit in?
That's a really good question, and it hits on probably the most controversial aspect of equine Lyme. Yes, things like sporadic lameness, lameness that moves around, generalized stiffness, maybe a reluctance to move, sometimes swollen joints, muscle soreness, poor performance, just being lethargic, chronic weight loss, maybe a low-grade fever. These have all been anecdotally linked to Lyme disease. And we do know that bacteria, Borrelia, can live in synovial membranes, the joint linings.
Right, so there's a potential mechanism there.
There is. However, the actual scientific evidence, the proof, directly linking Borrelia infection to chronic lameness, arthritis, or that generalized stiffness in horses, while it's considered pretty limited by many experts, it's often much more likely that those signs are due to other very common musculoskeletal problems like osteoarthritis,
So it becomes a real diagnostic challenge. How do you tell the difference?
Exactly. That's the million-dollar question. How do you differentiate? It really highlights why diagnosis is so complex.
Okay, so let's dig into that diagnostic puzzle. It sounds incredibly challenging, especially with those nonspecific signs floating around. How do vets approach it?
It is absolutely challenging, and probably the single most important thing for owners to understand about testing is this. A positive blood test, a positive serological test, only means the horse was exposed at some point.
Right. Exposure, not necessarily active disease.
Precisely. It does not automatically mean the horse has active clinical Lyme disease that's causing its current problems. That's a huge point of confusion. Because of that, diagnosis really has to be multifactorial. It involves looking at the whole picture, and often it ends up being what we call a diagnosis of exclusion.
Meaning you rule everything else out first.
Pretty much, yeah.
Okay. So what are the key pieces of that puzzle? What criteria need to line up for a vet to say, okay, we think this is clinical Lyme disease?
There are generally four main criteria that vets look for to make a presumptive diagnosis. They all kind of need to fit together. One, the horse has to live in, or have recently traveled to, an area where we know these Ixodes ticks and Lyme disease are common, an endemic area. Geography matters.
Makes sense. Location, location, location.
Two, the horse needs to be showing clinical signs that are consistent with those documented Lyme syndromes we talked about, the neuroborreliosis, the uveitis, the skin thing, or signs like lameness or stiffness, but only after other common causes for those signs have been thoroughly ruled out.
Okay, so rule out arthritis first if it's lameness.
Exactly. Which leads to number three. A really thorough diagnostic workup has to be done to exclude those other common diseases that can mimic Lyme. So for neurological signs, you'd rule out EPM, wobblers, things like that. For lameness, you rule out joint disease, soft tissue injuries. For uveitis, you rule out ERU, equine recurrent uveitis, or trauma.
Right. A lot of other possibilities.
And then number four, you need that serological evidence, a positive antibody test showing exposure to Borrelia burgdorferi.
So all four need to be there, really.
Ideally, yes, for a confident presumptive diagnosis.
Okay, let's talk about that serological evidence, the antibody tests. What's considered the best test right now, the gold standard? And I hear these terms, OSPA, OSPC, OSPF thrown around. What do they actually mean?
Yeah, the equine Lyme multiplex assay developed at Cornell University is currently seen as the most informative test we have. It's really quite clever. Instead of just giving a single positive or negative, it measures antibodies to 3 specific outer surface proteins, the OSPs of the bacteria, and each one tells a different part of the story.
Okay, break those down for us. OSPA.
OSPA antibodies usually indicate vaccination if the horse was vaccinated with a vaccine containing OSPA, like some of the canine ones used off-label. In a naturally infected horse that hasn't been vaccinated, OSPA levels are typically low or 0 because the bacteria actually stop producing OSPA once they get inside the horse.
Okay, so high OSPA likely means vaccinated. What about OSPC?
OSPC is your marker for early infection. Antibodies to OSPC pop up pretty quickly, maybe within 3 to 5 weeks after the tick bite, and they usually start to decline after about 4 or 5 months. So positive OSPC suggests a relatively recent infection.
Early stage marker. Got
Good.
it. And OSPF.
OSPF indicates chronic infection. These antibodies show up later, maybe 7 to 11 weeks post-infection, but they stick around for a long time, months, even years. OSPF levels are often high in horses that have had the infection for a while, especially those with ongoing clinical signs.
So chronic narker. That makes sense.
Right. So the pattern of these OSPs is what's really useful, looking at the combination. For instance, if you have high OSPF but your OSPC is low or negative, that strongly points towards a chronic established infection, not something brand new. It helps differentiate the stage of infection, and it helps sort out whether a positive result might be due to vaccination versus natural exposure.
That's much more informative than just a simple positive negative. Are there other tests people might encounter?
Yes, there are. There's the standard ELISA test, enzyme-linked immunosorbent assay. It detects general antibodies to Borrelia, but it's not as specific as the multiplex. It doesn't tell you which antibodies. There's also the C6 ELISA. This is actually part of the Sanimap 4DX Plus test that vets use commonly for dogs. It can be used in horses, too. C6 antibodies tend to indicate a more recent or active infection, and they often decrease with successful treatment, which can be helpful for monitoring. And then there's the Western blot, which is sometimes used as a confirmatory test if results are ambiguous.
Okay, so several tools, but the multiplex sounds like it gives the most detailed picture.
Generally, yes, but it's also really important to know the limitations. Even with these tests. For example, if you suspect neuroborreliosis and test the spinal fluid with PCR looking for bacterial DNA, that test has very low sensitivity.
Meaning a negative result doesn't rule it out.
Exactly. A negative PCR on CSF doesn't mean the horse doesn't have neuroborreliosis. And maybe surprisingly, the actual level, the magnitude of the antibody titer, how high the numbers are, doesn't seem to correlate well with how likely the horse is to be clinically sick or how severe the signs are.
Huh. So a really high titer doesn't automatically mean a really sick horse.
Not necessarily, no. It's complex.
Okay, so let's assume we've gone through all that, the criteria line up, and a presumptive diagnosis of clinical Lyme is made. How do we treat it? Is there like one standard treatment plan?
Yeah, moving to treatment, there isn't really a single, universally agreed upon gold standard protocol. Research is definitely still ongoing in this area, but the main approach involves giving antibiotics, usually for a fairly long duration. The key thing is choosing an antibiotic that can actually get into the tissues where the Borrelia bacteria like to hide out.
Right, you mentioned connective tissue, joints, maybe nerves.
Exactly. So you need an antibiotic with good penetration into those areas, joints, connective tissue, and potentially crossing the blood-brain barrier for neuro cases or into the eye for uveitis.
So which antibiotics fit the bill? What are the main choices?
The tetracycline family of antibiotics are generally the first line. There are a few options there. Doxycycline is very commonly used. It's given orally. Usually the dose is $10 Texmelia twice a day. Treatment duration is typically at least 4 to 8 weeks, but sometimes longer, especially for chronic cases or more severe signs.
Okay, Doxy. Pros and cons.
Pro is it has pretty good oral bioavailability, meaning the horse absorbs it well from the gut. It also seems to have some anti-inflammatory effects, which might help with the symptoms. The main con is it can sometimes cause stomach upset, maybe diarrhea.
Right, always a concern with oral antibiotics in horses. What else in that family?
Minocycline, also oral, doses $4 Texmelia twice daily. The big advantage of minocycline is that it gets into the central nervous system, the CSF, and also into the eye fluids, better than doxycycline does.
Ah, so potentially a better choice for the neuroborreliosis or the uveitis cases.
Potentially, yes. If you need really good penetration into those specific areas, minocycline might be preferred. Then there's oxytetracycline. This one is given intravenously, IV. The dose is usually $5–10 texaminotate every 12 or 24 hours. Vets might use IV oxytetracycline for the first week or maybe 10 days of treatment. The idea is to hit the infection hard and get high drug levels in the tissues quickly, and then transition to oral doxycycline or minocycline for the remainder of the course.
Okay, so a combination approach sometimes. Are there antibiotics that don't work well or ones to avoid?
Yes, definitely. Penicillin G, for instance. While it might kill the bacteria in a lab dish, in vitro, its effectiveness in horses with Lyme is questionable, mostly due to challenges with getting good levels into the right tissues with practical dosing.
Okay. Any others to be wary of?
Ceftriaxone is a big one to mention. It's used effectively in human Lyme disease, but in horses, it's been linked to some really severe, potentially life-threatening side effects like bad gastrointestinal disease, colitis, and even anaphylactic reactions. So generally, it's avoided in horses for Lyme.
Wow, okay, good to know.
Yeah, and other common antibiotics like amikacin, amoxicillin, things like azithromycin or erythromycin, enrofloxacin, even trimethoprim sulfa, they're generally not considered effective or recommended for treating equine Lyme disease.
So stick with the tetracyclines mostly.
That's the mainstay. And it's interesting, we mentioned doxycycline has anti-inflammatory effects. The tetracyclines in general might help not just by killing the bacteria, but also by calming down some of that inflammation associated with the infection. That could be part of why horses seem to improve on them.
That makes sense. What about other supportive therapies alongside the antibiotics?
Oh, absolutely. Supportive care is often crucial. Anti-inflammatories like NSAIDs, phenylbutazone, or flunixin can be really important for managing pain and stiffness, especially early on. For uveitis cases, aggressive topical treatment for the eye is essential. That usually means corticosteroid eye drops or ointments to fight the inflammation, and atropine to dilate the pupil and relieve pain. And giving the long antibiotic courses, using probiotics to help support the horse's gut health is often a good idea, trying to prevent antibiotic-associated diarrhea.
Right, protecting the gut. So once you start treatment, how do you actually know if it's working? Do you retest the antibody levels, the OSPs?
That's another really key point and a common question. The main way you judge treatment success is by looking at the horse. Is there an improvement in the clinical signs? That's your primary indicator.
So if the lameness gets better or the eye looks less inflamed,
Exactly. Antibody levels, particularly that chronic marker OSPF, they go down very slowly after treatment. We're talking months, sometimes even years. So you should not rely on antibody titers going back to zero or even decreasing significantly to decide when to stop antibiotics or to say the horse is cured. Many horses stay seropositive for a very long time, even if the infection is clinically resolved.
okay, so focus on the horse, not just the blood test numbers.
Precisely. Clinical improvement is key.
This all really underscores that prevention seems like the way to go, doesn't it? Given how tricky diagnosis and treatment can be, what are the best strategies for preventing equine Lyme disease?
You hit the nail on the head. Prevention is absolutely the best strategy, and it really boils down to reducing your horse's exposure to those infected ticks, especially since, as we mentioned, there isn't an officially licensed equine Lyme vaccine that's widely available, at least not in the U.S. and many other places.
Okay, reducing tick exposure, what does that involve? I've heard the term tick-scaping. What's that about?
Yeah, tick-scaping. It's basically about managing the horse's environment, the pastures, and turnout areas to make them less friendly for ticks. Simple things like mowing regularly to keep the grass short. Ticks like tall grass. Removing leaf litter, brush piles, wood piles, tall weeds along fence lines. These are all places ticks love to hide and wait for a host. Some people also create a buffer zone, maybe 3 feet wide or more, using wood chips or gravel, between wooded areas and the pasture edge. That can help discourage ticks from migrating into the grazing areas.
Smart. Environmental control. What about things you can do directly on the horse?
Definitely. Using tick repellents is important. Products containing permethrin are often recommended, but always follow the label instructions carefully regarding application frequency and safety. And thinking bigger picture, trying to reduce the populations of the animals involved in the tick life cycle around the property can help too. Things like managing rodent populations, the white-footed mice, and maybe discouraging deer from congregating right near pastures, though that can be challenging, obviously.
Yeah, keeping deer away is tough. So environment repellents. What's the absolute most critical daily habit for a horse owner?
Daily tick checks and prompt removal, no question. It's the most effective thing an owner can do themselves. Make it part of your daily grooming routine. Every single day, especially after the horse has been turned out, go over them carefully. Pay extra attention to the spots ticks love to hide: under the tail, around the udder or sheath area, in the groin, the armpits, inside and behind the ears, on the face, deep in the mane and at the tail head.
Tick everywhere, basically.
Everywhere. And remember that critical transmission time, usually over 24 hours. If you find and remove ticks within that window, you drastically reduce the chance of transmission. So being diligent every day really pays off.
That makes so much sense. Now, you mentioned no licensed equine vaccine, but I know people talk about using the canine Lyme vaccines off-label. What's the thinking there? Is there any evidence it works?
That's a common discussion in endemic areas, absolutely. So while it's true there are no Lyme vaccines specifically licensed for horses in the US, some of the canine vaccines, particularly the recombinant OSPA vaccines, have been used off-label in horses. There's actually reasonable scientific evidence suggesting they might offer at least partial protection. The idea is that the horse develops antibodies against OSPA from the vaccine. Then, when a tick bites the horse and ingests blood containing these OSPA antibodies, the antibodies attack the Borrelia bacteria while they are still inside the tick's gut because the bacteria express OSPA in the tick.
Ah, so he tries to kill the bacteria in the tick before it can even transmit.
That's the theory, yes, potentially preventing transmission. However, it's crucial to understand this is off-label use. Specific vaccination protocols, optimal timing, duration of immunity for horses, that hasn't been fully established through rigorous equine-specific studies.
So it's really a conversation to have with your vet.
Absolutely. It's a decision that needs careful consideration between the owner and their veterinarian, weighing the potential benefits against the lack of specific equine data and the off-label status, considering the horse's individual risk.
Okay, so let's bring this all together. We've gone through the bacteria, the signs, the diagnosis, treatment, prevention. What's the bottom line for a horse that does get diagnosed with Borrelia burgdorferi infection? What's the general prognosis, the outlook?
Overall, the prognosis for horses simply exposed to Borrelia burgdorferi is generally good for survival. Remember, most exposed horses don't actually develop clinical illness. However, for the horses that do develop clinical Lyme disease, the prognosis becomes much more variable. It really depends heavily on which syndrome they develop, neuro, uveitis, etc., and critically, how quickly treatment is started.
So time is of the essence if they do show signs.
Definitely. And there's quite a difference in expected outcomes. For, say, uncomplicated cases, maybe some mild general stiffness or lethargy that responds well to antibiotics, the prognosis for improvement and getting back to normal function is generally pretty good.
That's encouraging. But what about those more severe forms, the neuroborreliosis or the Lyme uveitis? Is the outlook as positive there?
Unfortunately, no. Those specific forms tend to carry a more guarded to poor prognosis for a complete recovery. With neuroborreliosis, even with treatment, some neurological deficits might be permanent. There aren't actually that many published reports of completely successful treatments for confirmed neuroborreliosis. And Lyme-associated uveitis, as we mentioned, if it's not caught early and managed very aggressively, it can definitely lead to irreversible damage to the eye, including blindness.
So those are much more serious outcomes.
They are. And even for less severe chronic cases, horses might need longer treatment courses, and maybe the clinical signs don't resolve completely, or they resolve very slowly. It's also not uncommon for horses to seem better after treatment, but then have a relapse of signs later on, sometimes needing another round of antibiotics.
So persistence can be an issue too.
It can be.
Given that guarded prognosis for the severe forms and the challenges we've discussed, what's the most crucial takeaway message for horse owners, especially those living in tick-heavy areas?
I think it comes down to vigilance on multiple fronts. Early diagnosis is key, recognizing potential signs and involving your vet promptly. If treatment is needed, initiating aggressive, appropriate antibiotic therapy as soon as possible. And underpinning all of that is rigorous, consistent tick prevention. Those three things, early diagnosis, proper treatment, and robust prevention, are absolutely vital for managing equine Lyme and giving horses the best chance at a good outcome.
That really was a thorough deep dive into equine Lyme disease. Thank you. We've covered a lot, from the tiny spear shed itself, through its complicated effects on the horse, right down to the practical steps you can take every day to protect them.
Yeah, hopefully this discussion helps everyone listening navigate the complexities a bit better, to understand why that early detection is so important, why prevention is really your best tool, and maybe why Lyme remains such a diagnostic puzzle sometimes for everyone involved.
Absolutely. And maybe a final thought for you, our listener, to mull over. We've talked a lot about how challenging Lyme disease is to definitively diagnose, how varied the symptoms are, and that prognosis for severe cases can be quite poor. So thinking ahead, what new strategies, maybe new tools or approaches might we need to help vets and horse owners identify Lyme even earlier, before that really significant, potentially irreversible damage occurs? What stands out to you about tackling that particular challenge going forward?